Hi, welcome to Suman TV viewers. I am Dr. Chava Anjaneyulu, Senior ENT Surgeon, working with the Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is having the laser surgery facility which help to cure the problem of the patient simply. Suppose if you see nasal obstruction due to inferior turbinate hypertrophy, you can simply reduce the inferior turbinate with laser and we can improve the airway very well. Same if there are any small growths in the oral cavity, we can remove with the laser. In many cases, the voice problems are due to vocal cord polyp and nodules. Those if we can remove the lesions with laser accurately, results are excellent, patient voice come back to normal. In olden days, if you go to the doctor, first they will see your tongue. They will ask you to open your mouth and keep the tongue out. So there are the advantages of the tongue surface. By that we can diagnose the many diseases in patient, especially general diseases like anemia, jaundice, dehydration, sometimes local diseases like candidiasis, mucosal disease, and rarely carcinomas also, especially in smokers, tobacco chewers. The common problem in India, olden days, is the anemia. This pale, dry tongue, mostly due to the anemia. If the hemoglobin is less than 6 or 5, the tongue is white and very pale. In olden days, females have more problems of the anemia in Indian subcontinent. So we diagnose their anemia by seeing the tongue. Other common issue is the diabetic patients with candidiasis. In diabetic patients, they will have the problem of burning sensation in the oral cavity and pain on the tongue with the hot food intake or spicy food intake. If you examine, you see the white patches on the tongue, sometimes exfoliations or proliferative white patches. These are not good. You have to diagnose the condition, treat it. Otherwise, long-term candidiasis may lead to the carcinoma of the tongue. The other thing is jaundice. If bilirubin is more in blood, that will show discoloration of the tongue also. So usually if jaundice subsides, in olden days the tests are not much available, that time they will see the tongue, they diagnose that disease is resolving or increasing. The other more important is the carcinoma. In smokers, tobacco chewers, if there is a painful ulcer on the tongue, which is not getting relieved with the medicines or not subsiding, that is persistent ulcer on the tongue. It is very important, don't neglect. Take the biopsy, because even small lesions, if you neglect, even in days it may spread to the neck nodes and your diagnosis will change and surgery also will increase, that is surgical removal. So whenever you find painful ulcer on the tongue, especially in smokers, remove that ulcer, do the biopsy immediately. The other one is the multiple ulcers in the tongue. These are the aphthous ulcers, stress-induced ulcer, gastroesophageal reflux diseased ulcers. Usually patient has any gastrointestinal problem like gastritis or constipation, they may have more chance of the tongue ulcers. Same if children, especially those who are going to exam, intermediate 10th class, they have the ulcers on the tongue. These are due to the stress-induced ulcers. And ulcers on the tongue also may be due to vitamin deficiencies, especially riboflavin, other B complex deficiencies. So by seeing the tongue, we can see general condition of the patient, especially dehydration. By seeing the tongue in children, we can assess they are very much dehydrated. We have to give the fluids to replace the dehydration. So tongue gives mainly general condition of the patient, that means weakness or dehydration, and some pathological conditions like anemia and jaundice, and local pathological conditions like candidiasis and carcinoma, leukoplakia, other autoimmune disorders. If you have any problem in the tongue, especially ulcers or white patches, contact Asian ENT Care Center located in Panjagutta, Hyderabad. For further updates, subscribe Suman TV channel.